So you've done your preparation. Now let's talk about how to get the most out of your medicine experience on dosing day. Your ketamine experience will take place in a comfortable setting. When we do ketamine assisted therapy and other types of psychedelic assisted therapy, we like to pay special attention to what is referred to as the set or the mindset and the setting. We've talked about mental preparation, intention setting, so the setting will be as comfortable as possible as we can provide. So you'll be in a comfortable recliner or a couch, you'll have pillows, you'll have blankets. We'll try to make it comfy for you. And you'll also be given an eye shade to eliminate visual distraction and stimuli and to promote an inward journey. You'll also be given headphones, or music will be played from a speaker. So we use music because it seems that music can act as like the wind in the sails of the experience. Different songs can create different chapters of the experience, and it can really be evocative and a really helpful tool in combination with the medicine to help you go deep and go expansive. Of course, if there is a song that you don't really like, you're welcome to ask your therapist to skip it. Some of our clients like to bring their own playlists. Generally speaking, if you're new to the ketamine experience, we suggest that you use our music first before you come up with, your own music to listen to during your medicine experience. Before you're given the medicine, you and your therapist will review your intentions. You'll review any grounding practices that you discussed during preparation, like mindfulness meditation or deep breathing exercises. And you'll also go over your preference for other types of support, specifically whether or not you want any support via physical touch. This might be something like a handhold or a hand on your shoulder. It's important that, of course, you consent to anything like this. And please understand that there will be no touch foisted upon you unless, you're falling off the couch or something like that. And in that case, your therapist will likely try to touch you to help prevent you from injuring yourself. So then you'll receive the medicine via the route of administration that you and your provider have agreed upon. So I referred to some of these tips I'm about to give you earlier, but I would just want to drill down on these. So these are some tips just to help you navigate the medicine experience. As the medicine comes on, it can feel intense. Again, depending on the route of administration, that intensity might vary. So it's important during that initiation phase that you breathe deeply, that you ponder your intention, and that generally speaking, you're just letting yourself be open to the experience. Remember that advice about letting go, leaning in and through, stay curious, surrender. That's really going to serve you throughout the entire arc of the experience. Speaking of the arc of the experience, it does tend to follow kind of a curve, and it can be wave-like on that curve with brief periods of intensity and rest. But generally speaking, there's this sort of initiation phase, then there's a peak or a plateau, and then there's a tapering phase. So at various times on that arc, you might need more or less support from your therapist. They'll be there with you. There might be times where you want to talk. You might not want to talk at all. You might not remember how to talk. Remember, these are consciousness-altering medicines. So don't feel pressured to do anything. Again, just sort of go with the flow. And if you can, bring your mind back to the intention that you set for that medicine experience. It's also important that you don't feel pressured to make sense of anything. It might be very, very interesting, and it might be very revelatory, and you might have really keen insights, or it might be kind of confusing. So it's not important that you make sense of everything in that moment. The sense making will be more of the focus during the integration phase of ketamine assisted therapy. So stay open, stay curious, go with the flow. In the moments immediately following the journey during that taper, you might feel really, really good in your body as you come back into contact with your body. You might also feel a little disoriented. You might feel tired. You might feel dizzy. Like I said, you're going to be handed off to your support person, your ride. And also, like I said, clear the day and spend the rest of that day in rest and quiet reflection and contemplation. Some people will like to journal their experience, try to capture the stuff that they experienced before it dissolves and they forget. If you're having a hard time writing things, then I would encourage you, like I said earlier, to just use like the voice memo thing on your phone and record as much as you can remember so that you can bring that back to your therapist and discuss it during the integration sessions. I mentioned this part with reference to your support person, but you might feel especially open and maybe even emotionally raw in the hours and days following your dosing session. So it's important to be judicious and selective about who you expose yourself to and talk to, especially about your experience. It's okay to keep some things private and sacred, especially as you're trying to make sense of them. When you do feel up to it, though, I like to encourage my clients to spend some time in nature. Go for a walk as you're thinking about your dosing day, and just reconnect with the present moment. And do your best to protect yourself from normal life rushing in. I know it varies depending on how much control you have over that, but if you have some control, try to protect this time for quiet reflection, healing, and contemplation.